Well, we boomers know that as we age, sometimes things hurt a little bit. Maybe your back hurts a little bit. It goes with the territory, right? Anyway, we're going to join Eunice Trotter, and she's taking us to American Senior Communities for boomers, and even if you're not a boomer, you might want to take advantage of this spine therapy. Eunice?
Thanks, Patty. We're here with Dan McKenzie today, and Dan is the rehab specialist for American Senior Communities. And we're here to talk about back pain. Dan, lots of people suffer with back pain. And I know I do. I sit all day and then I get up and my back is aching.
Absolutely.
What can we do?
There's several things we can do. First and foremost, exercise. A lot of people don't realize very simple things without equipment can be done. I'm going to have Howard kind of demonstrate a couple things that we can actually do without equipment. It's called a hip hinge exercise. So what Howard's going to do is scoot to the edge of the chair with good, neutral, stable posture. Without using his hands, he's going to actually raise his bottom 2 to 3 inches very carefully and then down slow. What this will actually do is develop strength in our core muscles, which are necessary for posture and stabilization. Because as a society, we're at our desk for hours and hours. We get forward shoulders, forward head, and poor posture, which also contributes to back pain.
And this is something I can do at the office.
Absolutely, at the office, at home, anywhere. Just need a chair.
Okay.
Okay, the next thing we'll have him do to demonstrate is stand up. And this is really simple. We're gonna work on just basically posture. So we want our shoulders back, retracted, head aligned appropriately, which he does well. We're gonna breathe from our diaphragm. A lot of us actually breathe from our chest because it's just how we typically sit. So we're gonna have him actually do some deep diaphragmatic breathing here, in through the nose and out through the mouth while maintaining his posture.
And this device looks like a remote control, but it's actually a direct microcurrent system designed to ease pain.
So with low back pain, we typically treat the entire spine. So oftentimes the neck is involved as well as the low back. So what we actually do is locate, when you hear a high pitch, we're on a treatment point. Okay, then we stimulate the current in approximately 30 seconds at each point or trigger point. We're basically stimulating nerve roots for pain relief.
So how does this feel to the patient receiving this treatment?
It's kind of like a ballpoint tip on the skin. We're not puncturing the skin as a needle. It's just really the way of the device on the skin, so it's very gentle.
Sometimes back pain is so severe that surgery is required. And for a speedy recovery, patients choose American Senior Communities Moving Forward Rehabilitation Program.
We have modalities to work on the pain, range of motion, get them up and ambulating, and we have a lot of equipment in the gym that will help us along the way with that.
So people kind of go through pain to get rid of pain.
In a sense, but it's more just getting rid of a lot of the pain after surgery and the discomfort that they have. And we try to use the modalities instead of having medication to slow down the therapy so we can get them home faster.
And the New Energy Wellness Center is open to the public with 8 Central Indiana locations. Just go to ascseniorcare.com and click on services for a complete list. I'm Eunice Trotter for Boomer TV.